Hello everyone, my name is Maggie Gill. I'm the CEO of the Palm Beach Health Network, and this is episode 2 of Getting Candid on COVID. And joining me today is Julie Abbate, who is a nurse practitioner at Delray Medical Center. And together we're going to continue our conversation about providing information and education about this pandemic. In our first video, we asked for you to send us your questions, and we received quite a number of questions, Julie.
Yes, we did.
So why don't we just jump straight into it and see what questions people had that we can answer for them.
One of the big questions that we did get is regarding our surgeries. What are we doing with the surgeries? Have they been canceled? Our joints and total joints and hips and all of the orthopedic procedures that we do?
That's a great question. On Friday, the governor came out with an executive order to manage the elective surgery process, essentially. And so while we were always applying discipline and looking at cases to make sure that if they were truly discretionary in nature, we were rescheduling them, or if a patient was high risk, that we were having a conversation with the surgeon. There's some additional criteria that was issued from the state on Friday that we're adhering to. Essentially, that will further curtail the amount of elective surgery that we're doing. And the reason for that is to keep people safe, to keep people out of the hospital if they don't need to be. We're still providing care for those who need it, if it's a life-saving issue or if it's a continuation of a care pathway that will improve someone's health. For example, cancer. We're not going to stop treating cancer. If it's an orthopedic case, if it's a fracture, obviously we'll continue to treat that. If it's a truly elective procedure that can wait, we're going to wait. And so we are managing that on a case-by-case basis. We're involving the surgeon, anesthesia, and our clinical leadership in the operating room.
So one of the other things, we've had overwhelming questions about what people in the community can do for our staff. A lot of outpouring of support, which has been wonderful. What can we tell the community to do for us?
I appreciate that, and we really do. We have the best staff taking care of our patients. So send them a cheer card to the email address on your screen. They will love it. They will appreciate the support. And also be safe, stay home, practice safe social distancing, wash your hands, and make sure that you stay out of the hospital.
Great. In regards to telehealth options, what do we have available? What are we planning on? What can we do from that standpoint?
So that has gotten a lot of traction lately because people don't want to necessarily go to their physician to get a consult, but they might need to talk to their physician about an issue. So we are expanding telemedicine in our physician practices, and we're working on some additional capabilities in the hospital. So as a company, we're working quickly to expand our capabilities.
So Maggie, are there any other tools that we have that for people in the community to look for education, information in regards to COVID?
Yes, we do. We have a COVID-19 assessment tool on the hospital websites that complements, obviously, the expansion we have in telemedicine. And so we want to make sure that people are educated.
So one of the questions too is about family members. They have loved ones in the hospital, they're worried about them. What options do we have for those people to get in contact with their loved ones, to communicate with them?
I'm glad you asked that question because last week, as I mentioned, we restricted visiting hours and then we went to a no visitor policy in our hospitals. So with the exception of a few situations and situations including life-threatening situations, trauma, deliveries, and children, where we're limiting visitors to one person, we have essentially foregone visitors. And that's really for the safety of everyone. We are encouraging everyone to communicate, with their devices, their phones, their iPads, anything they can. We're helping that in the hospital. So we have some devices that our patients can use if they need to. And so we wanted people to stay connected. We know that they can get lonely, but on the other hand, the best thing we can do to keep people safe is to keep them away from other people. Another option is you can go on each hospital's website and you can send a cheer card. So that is an option, just to send a nice thank you or thinking of you note to a patient.
That's great. Another question, staffing. Our nurses here, we have an exceptional staff here, including our physicians, our nurses, and all the ancillary departments. How are we doing with staffing in regards to the response to this COVID?
Yes, so all 5 hospitals have a staffing plan that looks at what their needs are within their facilities and then how they can share staff between facilities if need be. And so we are seeing an increased demand with nursing. We have scaled back some of our outpatient areas. So for example, this week we announced some closings with our outpatient imaging. And so some staff will be moving around and other staff will be ramped up just to depend on whatever the patient volume is. But we're managing that very closely. We feel good about the staff we have available, and we'll continue to support our staff as they take care of our patients.
Great. So Maggie, we're getting a lot of questions about our protective equipment that we use here in the hospital. There's been a lot of reports on the news about PPE usage and our hospital. Tell us about that.
So that's a great question, and it keeps coming up because you're hearing a lot out there in the news about shortage of PPE, and people have concerns about it.
Sure.
So we continue to focus on the appropriate use of PPE following the CDC guidelines. So I want to emphasize that we are following the CDC guidelines for protective equipment. We're still managing our inventory very, very closely, and we're providing our staff with what they need to take care of patients.
That's great to hear.
We also sent our last video out to a number of retirement and housing communities to make sure that we were sharing information, and we're also asking them if they're practicing safe social distancing, if they have stopped having their social gatherings, if people understand it's important to wash your hands, and just making sure that our community is educated. The best thing we can do right now is to practice safety measures so that we can contain and control. I want to ask everyone to again send in your questions. We're going to turn these videos around quickly so we can get the information back out to you. So we've talked on this video and the prior video several times about proper hand washing. So I'd like to ask Julie to demonstrate the proper hand washing technique so everyone sees it.
I would be happy to. Hi, I'm Julie Abbate, nurse practitioner here at Delray Medical Center. I'm going to show you proper hand washing today. Many people ask when is the proper time to hand wash, and basically if you touch any surfaces after you use the restroom, if you cough or sneeze into your hands or blow your nose, any of those instances are when we should be washing our hands. Anytime you think you can contaminate your hands by touching surfaces, especially in this COVID-19 era when we're dealing with all these different things. So we need to make sure we have really good hand washing. So that's what I'm going to show you today. So when we wash our hands, we always want to turn on the water first. Go ahead and get your hands wet, and then we're going to use some soap, and ideally we're going to wash our hands for 20 seconds. So when we think about washing our hands for 20 seconds, the best way to remember how to do that is to hum happy birthday twice. So when we're doing this, we're making sure that we're going in between the fingers, that we're getting the full hand all the way around the palms, all the surfaces of the hand we want to make sure that we do. So when we go through this for about 20 seconds, after we're done with humming happy birthday twice, we want to go ahead and rinse off everything that we've got on our hands. So all the soap needs to be rinsed. Make sure you get a good rinsing of everything off. And then we're going to go ahead and we're going to get a paper towel at home, whatever you have, dry your hands off well. And you're going to want to turn the sink off with a paper towel so we're not touching any more surfaces. So again, that's 20 seconds, and that is the best way to do hand washing.
Thank you very much. And then I'd like to close with Dr. Oshiami providing some misconceptions about COVID-19. And I invite everyone to join in next time and stay safe. Thank you.
There are some misconceptions regarding COVID-19. We'll kind of touch upon some of those. One is a lot of people do get this infection and they have mild illness and they do recover very well. What we do know is that people think because the older population of patients with chronic illnesses who are definitely at high risk of severe illness are the only ones to be worried, and that's another misconception. Because when you're young, even though you may recover quickly, you may get infected and pass this on to your own family members who may be at risk. So everyone is at risk of getting infection. So I have to say that again, everyone is at risk of getting COVID infection. Some people just don't get very sick. So if you're one of those people who don't get very sick, you could infect someone that can get very sick and put them at risk. Another misconception is that people ask me if they should get their flu vaccine or pneumonia vaccine. That is a great question, because if you can get your pneumonia vaccine, you can at least protect yourself from getting bacterial infection. Because anytime you have a viral infection, there's a possibility of getting a secondary pneumonia infection. The other issue is that influenza symptoms are similar to COVID-19 symptoms. So if you can get a vaccine against influenza, you can at least protect yourself from one of those viruses. Well, you have the COVID-19, as you know, but you also have the MERS, the SARS that we've had in the past. There's also the RSV, which is still present. You have adenoviruses. So the adenoviruses and the RSV are not as severe, but in case the RSV can be very severe. So influenza can be deadly in the very young, less than 2 years of age, especially pregnant women or people over the age of 65. COVID-19 is more deadly in patients who are older or patients who have chronic illnesses. So you could be a 27-year-old if you have chronic illnesses such as heart failure, that could put you at the same risk as an older person. So that's the other misconception out there. The best protection is really hand washing and social distancing. So this virus is transmitted via droplet, and in some scenario airborne. But majority is by droplet, meaning that if somebody coughs and you're within 6 feet of them, you can contract the virus. That means if you can distance yourself from a large crowd, you are less likely to contract this infection. Other means is by washing your hands. If somebody coughs on a surface and you come right behind them and you touch that surface, then you're coming in contact with the virus. So hand washing is very important, not only to keep yourself from getting infected from COVID-19, but hand washing also protects you from other infectious agents.